Hello, and welcome to HIPAA in 30, effective HIPAA training in 30 quick lessons. So in helping you build your culture of compliance, we want to make sure that you understand that documentation is the key to showing that your organization is HIPAA compliant. I do want to remind you, I am not an attorney. No advice that I'm giving you today is legal advice. However, we stay on top of the bulletins and documents from the Office for Civil Rights, who enforces HIPAA, and the other related agencies. So you can be assured that you are getting up-to-date, complete HIPAA information today. HIPAA is federal law. HIPAA is actually composed of three separate rules: the HIPAA privacy rule, security rule, and breach notification rule. There's another new rule called information blocking that we call a cousin to HIPAA. It will have a very significant impact on your practice. Information blocking is part of the Cures Act, and it's any practice that is likely to interfere with the access, exchange, or use of electronic protected health information. Understand, it's a very broad category. Anything likely to interfere could be considered information blocking. So under HIPAA, what we protect is PHI, protected health information. This can be oral, written, or electronic. And basically, any identifiers that relate to a patient's past, present, future, physical, or mental condition is considered protected health information. You may hear the term EPHI. That stands for Electronic Protected Health Information, and that is what information blocking covers, is your EPHI. Also understand that under PHI, there is sensitive protected health information. Information that could cause harm, embarrassment to an individual financially, reputationally, or emotionally. Examples would be HIV testing, a pregnant teenager, or even if your account is in collections, that is considered specially protected under SPHI. The minimum necessary standard is the heart of the HIPAA privacy rule. And basically it just states that you only should access patient information that you have a medical reason to do so. So you should limit any unnecessary or inappropriate access or disclosure. So your job function should give you access to what you need and no more patient information than is necessary for your role in the organization. If you are requesting records from other providers, only ask for the records that you need. Do not access your own, family members, or friends' medical records for any other reason, again, than work purposes. And especially when you have access to other parties, such as hospitals, labs, or radiology facilities, make sure you do not use your access other than for, again, your work purposes. So under HIPAA, we have two ways to request records. One is through an authorization form. The other is the access form. So an authorization form is when a third party is requesting records on the patient. Most common would be a court subpoena. So there, an authorization has 9 specific elements that must be on there. It must include an expiration date, who the records are going to, the purpose of those records, and other required statements. An authorization permits but does not require your practice to release records. On the other hand, an access form is a form for the patient's use of their own medical records or to direct medical records to a third party. And an access form only really has to have the patient's name, where the records are coming from, where they're going to, and the patient's signature or verification that they've requested this. An access form, even though it has a lot less information, is more powerful than the authorization form because it requires you to fulfill that records request within 30 days. Remember, on authorizations, if you have SPHI on there, you want to make sure that the patient takes a second step to release those, such as if there is domestic violence information, the patient would need to, on the form, click yes, that information is a part of this authorization. In 2019, the Office for Civil Rights put out the Right of Access Initiative, outlining how practices must respond to patients' requests for their own medical records. We're going to go through all of these, but basically the designated record set, the type of records and how patients can request them, and how quickly you have to produce those records. So the access guidance clearly states that the patient has the right to the entire designated record set. That means that all of the records in your EHR and maybe even paper records that haven't been scanned in are available to the patient. That includes other physician records if you have them in your system, or even hospital records. You do not have to go out and obtain new records for the patient, but if you have them in your system, they must be provided upon request. Remember that if you put in notes, nurse's notes or other notes that you don't want the patient to see, that is not permitted. If you wrote them down, they're in the chart, they were used in that patient's care, they must be presentable to the patient. So be careful what you write in the chart. The Access Initiative set out new pricing for your office to use when charging patients for medical records. Now, you are not required to charge, but if you do, you can charge in one of two ways. We can charge a flat fee up to $6.50. So for 2 pages, you might just charge $2. But again, as long as we don't go over $6.50, we're fine. If you do go over $6.50, the government requires that you use a worksheet that has the allowable HIPAA cost for charging patients. So this is a worksheet on the screen that you can use. Basically, you can charge for the request to complete it. You can charge for the number of sheets of paper for paper and toner. If there's any postage or other charges, you can add that. The Office for Civil Rights is very clear to patients. If the practice charges you over $6.50 and doesn't give you a worksheet showing you how they came up with that, then they will call and ask for that worksheet. Fines for overcharging for medical records start at $25,000. The government put together this handy little graphic that kind of explains the process of getting a patient their medical records and what HIPAA requires you to do. So we can always ask for the patient to come in person and sign our access form. However, if the patient states that that could cause a delay or a burden in them getting their records, then we have to verify who they are. So they may send you an email, mail it, fax it in, phone it in, or the most common or best is the patient portal. We can always direct patients to the portal, but we cannot require that that's the only method that they get to use. When it comes to fulfilling those records, again, the patient can either come by and pick them up, we can mail them, fax them, email them, whatever is the most convenient method for the patient that they request. If you don't have that available, then you may work with the patient in coming to a conclusion on how to properly get them their medical records. Patients have a right to get their records in a digital format. That can include everything from putting it onto a CD, a thumb drive, or, as we'll talk about more, emailing it to the patient. Now, you're not required to go out and buy technology that you may not have. So most computers these days do not come with CD burners. So if the patient requested on a CD, you do not have to go out and purchase one. However, almost all computers do have ports for thumb drives, so you would have to put their records on a thumb drive. Understand that thumb drives are very dangerous devices because they can write information to your computer. So if the request is for a thumb drive, you have to purchase it, put the records on it, and then use that worksheet to put the appropriate cost that you can charge the patient and charge them for putting their records on a thumb drive. So email is considered to be readily producible by all covered entities. So you cannot tell the patient, we don't have an email address. You may not have one that you want to use for that, but HIPAA says you should and have to provide patients' records to them via email. Now, email is a dangerous way and method of sending medical records. So you do have to warn the patient, these records could be seen or intercepted. Do you accept that risk? You don't have to get them to sign off on that, but the email notice and warning that you see on the right side of the screen must be on that email. That is your documentation and verification that you have warned the patient and the patient accepted the risk. So patients have a right to be verified over the phone, and you cannot make those requests unreasonable. So if a patient calls in requesting their records, you can go to, it is our policy to have you come in and sign an access form. However, if the patient states that that would cause a burden or delay in them getting their medical records, then we are required to verify who they are. Your practice should have a couple of good verification questions, but again, don't make them too hard because that could be considered unreasonable. And most importantly, document in the chart that you verified their identity. I like using the shortcut VID. We verified their identity before releasing the records. A little known HIPAA right is the right not only to get copies of your medical records, but to inspect them. And so a patient has a right to, within 30 days, request that they come in, sit down at one of your terminals, and look at their medical records exactly as you see them. Most patients don't know about this and don't come in and ask for it, but that is their right under the HIPAA privacy rule. There are very few circumstances that you cannot honor a patient's request for their medical records. Two primary exceptions are one for psychotherapy notes. Those are notes taken during a counseling session. They're the thoughts of the therapist, and therefore they are immune from being released to the patient. The other are records taken in anticipation of a lawsuit or other legal matter. Those can be withheld from the patient as well. So under the Cures Act information blocking, you are required to immediately or within a reasonable time frame send records to other providers and send the records from the EMR to the patient portal. There are only 6 exceptions your office could use, and they must be documented if you do not share records. The most common would be the privacy exception. Here, we get a request from another provider, and again, where HIPAA permitted it, information blocking now requires it. But if we're unsure that this is a provider for the patient, we still have to protect the privacy of that patient. So I am now going to ask for an authorization or for an access form for the patient to direct the records to that office. If I do not fill out a privacy exception, I have violated the information blocking statutes, because if I know they're a provider, I must send the records. But if I'm not sure, I need to fill out my privacy exception form. Other ways to do that would be to verify, and again, document in the chart that this practice is asking for the records. They were able to verify the patient's name, date of birth, and they gave me their NPI number. So either of those methods would be permissible, but do understand if we do not send records immediately to the patient portal or to another continuity of care provider, we must fill out one of these information blocking forms. Patients have a right to request that you amend their medical record. And here I'd like to remind you that the medical record includes not only their treatment information, but also their payment information. So the one thing that you must understand is that your office has a duty to keep the record accurate and correct. However, if the patient's request is going to be denied, we must send them a letter stating the reason for that denial. Otherwise, amend the record to show the correction, but do not erase and rewrite the record. Patients have a right to request confidential communications. However, this is actually your right, because you have a right to contact your patients, let them know that their upcoming appointment is getting near, or to let them know that their test results are in. Remember that if anybody other than the patient picks up or the answering machine picks up, only leave the time and location information. Never discuss the reason for the visit or the testing information with anybody other than the patient. So patients have a right to request restrictions on who you share their information with. They could ask you not to send it to other providers. Now, that request is up to your office to determine what's in the best interest of the patient. If they're still seeing this provider, we probably want to continue sharing records and would deny their request. However, if they no longer see this office and want to make sure that the records don't go there, then that's something we'd probably agree to. Now, there is one request that is required for us to implement, and that is if they pay us out of pocket for a service or test and they do not want their insurance company to be notified, they have the right to do that. So only if the patient pays for that out of pocket can they ask you not to share it with their insurance plan. So whether you are a covered entity or a business associate, patients have a right to find out who you have disclosed their medical records to. Now, this right is limited because you do not have to account for anything that involves treatment, payment, or healthcare operations. So only things that fall outside of that. A court subpoena would definitely fall under an accounting of disclosures request. Submitting their information to the CDC, that is another disclosure that you would need to account for. So in your medical record, make sure that anything outside of treatment, payment, or healthcare operations is documented in case you receive one of these requests. And again, this can go to the office. It can also go to all of their business associates. Talking with family and friends. So HIPAA is very misunderstood under this. A lot of times we think if the patient hasn't put this person on the confidentiality list, I cannot talk with them. That is incorrect. We do have times when it is good, necessary, and in the best interest of the patient to disclose information to their caregivers, family, and friends. Now, the one thing that we always want to do is either ask permission or discuss it in front of the patient so that the patient has an opportunity to object. Some examples would be when your doctor may talk to your sister who is driving you home from the hospital about keeping your foot raised during the ride home. Your hospital may discuss charges with your daughter who's also at the hospital with you and has questions about what's being billed. Use your professional judgment and apply reasonable safeguards. What is that person's involvement in the patient's health care? Is this disclosure in the best interest of the patient and not inconsistent with other prior objections that the patient may have made? So always understand that if a patient requests you not to share information, the only way you can override that is if there is a serious and imminent threat of danger to the patient harming themselves or others, and the person you're disclosing this to is someone that can help alleviate that threat. So do understand patients have that right. Now, this is not a free-for-all for you to give the patient, family, and friends all of their information, but again, a part of their healthcare they're involved with and going over that information is allowed. Now, we get a lot of questions on when a patient is deceased. Can we share records with family and friends? And the answer is again, yes, again, using your professional judgment, again, not being inconsistent with the prior request of that patient, you can share records in those circumstances. But again, document your reason for disclosing those records. All covered entities are required to have a notice of privacy practices. It should be and is required to be in your lobby and on your website. You should take the time to read how your office has decided to disclose medical records because you are bound by those decisions. On the bottom of the notice of privacy practices is a statement that states patients have a right to file a complaint with your office or with the Office for Civil Rights. And patients are taking you up on that. The Office for Civil Rights is receiving on average 132 complaints per day. That number is up 39% over just the last couple of years. So understand patients are getting to learn their HIPAA rights and making sure that you implement them. The average HIPAA fine for violating a patient's privacy rights is $54,000. So do understand it is important for your practice to abide by the disclosures that are required by HIPAA. Now we're going to focus our attention on the HIPAA security rule, or otherwise known as healthcare cybersecurity. So the things we're going to discuss are paying close attention to email, using complex passwords and changing them on a regular basis, making sure all computers are set to log off after a period of inactivity, making sure least privilege is applied. Your office should only be giving you the access you need to perform your specific job functions. In small offices, I understand that you may have a lot more access because you do a lot more different tasks during the day, but again, least privilege must be adhered to. Workforce clearance procedures and training, all employees are required to be trained, and there are also sanctions for any violations of our HIPAA policies that we're going over here today. So security is everyone's responsibility. And I really want you to take to heart what we're going to go over in this video because of the fact that if you put these measures in place in your personal life, you will also be better protected from cybercrime. So some of the things that you need to understand is never disable your security controls. Never turn off your antivirus or firewalls or the other protective measures that IT has put into place. Do not install screensavers or other programs or photos without prior approval of the IT department. And never put in a thumb drive unless it's been purchased by the practice to be used. Thumb drives are very dangerous devices. Even bringing in one from home that's been used in your computers could be dangerous. When you leave your workstation, either put your screen down or hit Control L to lock the screen. So always when you're on the internet, use your common sense. Trust your gut feeling. If something doesn't feel right, it probably isn't, and you should stop and think about it. Always think when it comes to email, how did they get my email address? How did they get my phone number? All of those are important security concerns, and you have to be aware at all times. So why are medical records targeted? Well, they can make the cyber criminal a lot of money. I mean, but really, who cares if patient A has high blood pressure? Well, getting access to these medical records allows the cyber criminals to perform ransomware, lock up our files, and keep us from accessing them without paying a fee. Medicare fraud, the banking virus, exfiltration, just stealing the records and using them for, again, identity theft and other purposes. Medical records are extremely valuable and are highly targeted and sought after. So why do we need to be so diligent on preventing a successful cyber attack? Well, once they get on your system, it can expose all of the personal information of the employees and patients. Remember, as an employee, you've got a job. You are a perfect victim of identity theft if I have your employee file. Outside access of all of our records could be happen, and the files could be locked and become inaccessible. That's what we call ransomware, where the practice has to pay a fine to the cyber criminal or a fee to get access to your own medical records. Of course, any successful cyber attack being known to the community would definitely damage your reputation, and they can steal money from your bank account, or they're going after your paychecks as well. They can put fraudulent charges on your credit cards, or even open up loans and mortgages in your name. They can also steal or access your photos, videos, and other files to commit Medicare or medical fraud. And they can also do fake social media posts on your accounts. So you can see there's quite a bit that they can do. So once the attacker takes over your computer, they can view the screen, access all your files, capture your credentials, your usernames and passwords, download all the passwords that are stored in your browser, so not a safe place to keep your passwords, take pictures using the camera's built-in webcam, and record audio through the microphone. So anything and everything you can do, a cyber criminal can do by taking over just your one computer. The number one tool of the cyber attacker is the phishing email, trying to trick you into clicking on an attachment, clicking on a link, or disclosing personal information to the cyber criminal. So think, does the email have a sense of urgency? Does it request your personal information? Is it asking you to verify your account? Have you won a prize? Is it asking you to unsubscribe? Or very common these days is, here's an amazing job offer. Look at each email individually and decide whether or not you think it is safe to respond to. So when it comes to phishing emails, the best and easiest way to determine should I spend any more time with this email is by looking at that return email address. So this email is coming to me from Bank of America. It's telling me my account has been suspended, and I need to go and see what that PDF says so that I know what's going on. Why is my account suspended? But stopping and looking at that return email address, grouppharma@grouppharma.com.ec, well, if I got something from Bank of America, I would expect to @bankofamerica.com. Another clue here is that .ec at the end of it. So when I see two letters after the .com or .net, that's a country code. That means that EC means that this email is being redirected to Ecuador. So look at it and read the return email address as the #1 way to determine should I open this email. Here's another email coming to me, password reset. So it has my information, but again, I look at the return email address, support@copla.com. Well, I actually went and saw copla.com, and it is a legitimate website. However, it's a company that has nothing to do, that I have nothing to do with, and therefore there would be no reason for me to reset a password there. Look here, Dear MM. So that's pretty suspicious. If it was a company I was working with, they would have my name. And then underneath, I see access to this account will be restrict and block till proper verification. Not proper grammar. So again, I'm looking at things here and I'm not seeing it all add up. I'm not going to click on that keep same password or respond to this email. Look in the subject line. Is it a request? Is it urgent? Is it asking you for a payment or a greeting? And especially this time of year, is it coming from the IRS? When you see fake 1-800 numbers, that means they want you to call. There's actually a service on the dark web that you can go purchase that we will set up a call center, and when people call in, we will try to get their passwords and usernames out of them for you. If you're like me, you've been getting a lot of customer receipts from PayPal, either telling you that you've purchased something, or the one on the right that you've set up an automatic payment. The thing that I found suspicious on this one, other than the return email address, so it's coming from PayPal, but sharkamaili@gmail.com, again, I would expect to see at paypal.com. But the amount is for $378.10 on the left, and that's telling me that I purchased something. And then another email coming from a different Gmail address states that I have set up a payment, a recurring payment for exactly the same $378.10 USD. So that's also a pretty good indication that it wasn't sent from somebody inside the United States. So again, looking at the return email addresses, looking at it and seeing the date, seeing the order number, and all this other information tells me that this is not emails that I want to respond to or that I want to click on the attachment. So don't be multitasking when you're opening your email, and review the content thoroughly. I cannot overstress the importance of complex passwords. A complex password in today's environment is a minimum of 12 characters, upper and lowercase letters, 2 numbers, and a symbol. A complex password should be used for all passwords that protect important information, and including the logon password to your computer. Make sure that your EMR and practice management passwords are also complex. And one of the favorite targets of the cybercriminal for weak passwords is your email. Understand that once they take control of your email by getting into it with your password, they gain a lot of valuable information and can send out emails to your family and friends with malicious links attached that they would probably open. In 2021, 81% of breaches utilized weak or stolen passwords. So make sure we are not saving our passwords in a folder on our desktop called passwords, that we don't have them in our email under a folder called passwords. Don't save them in your browsers. These are all unsafe ways of saving your passwords. If you have Word or Excel, go to File, Info, and then password protect the document using a password to protect that list. If you write them down, keep them in a safe and secure spot. Again, passwords are your electronic fingerprint or your electronic signature, and you must guard them. At High Tech Associates, we really push the need for good, complex passwords changed on a regular basis. And this is a site that really shows you the importance. It's called Have I Been Pwned? It is a secure website that you can use to see if your email address, which we commonly use as a user ID, has been compromised from any of the sites where you're using it. So when I put in my own personal email address, I found that there are 11 data breaches in which my email address and the password used with that were compromised to the cyber criminals. Another nice tool on this site is pwned passwords. So you can see if the password you're using is in one of the password dictionary attacks created by the cyber criminals. So here I put in my current password, and good news, it's not on the dark web. I can continue to use that. So this is a great website for you to use to see the importance of good passwords and to check and make sure that your password hasn't been compromised. So the next security tip to go over is to remind you that when you are at the office, the internet is an unsafe place and you should only be using it for work-related searches and uses. So things like going shopping, celebrity websites, and social media are just way too dangerous. Only, again, use the internet for work purposes. When you're at home and you're going to be doing more searching, make sure you're using a good antivirus. Windows Defender is good but doesn't protect you as well as a Bitdefender, WebRoot, or other commercial software antivirus. Look around. You can find them for as little as $5 per computer per year, and highly recommend that you get additional and better antivirus. At this point, I also want to remind you that email must be encrypted when it is at rest and in transit. That means when I send an email with patient information, it must be encrypted. The only exception is to the patient when we documented that warning. Otherwise, if it's going to other providers or anywhere else, it must be an encrypted email. So again, a reminder that security is everyone's responsibility. And remember that the cyber criminals aren't just using the internet. It's rare, but they will call you on the phone and try to get information out of you. So be careful of what information you give out. Make sure you know who that person is on the other end of the phone. Now, from an auditing standpoint, HIPAA requires that your HIPAA compliance officer monitor the legitimate access to medical records by all the staff members. So you are being looked at. Your EMR carries a log of everything you've done when you enter the system, and to be good with security, your office is doing a monthly report showing that the access by all of the staff members was legitimate and correct. Remember that one of the things that the cyber criminals do is to steal your credentials and then use those credentials to access and steal patient information. So that's what we're looking for. Do understand it is a required component of HIPAA compliance. So some final words on security. A lot of us are working at home now, either full-time or part-time, and you need to make sure that you apply security when you're working from home as well. So whether you're using a company computer or your own computer, make sure it is patched and up to date. If you don't understand that, definitely get with your IT professional and ask them how you can make sure that your computer stays up to date with patches. Again, at home, do not bypass your antivirus or other security measures that have been put into place. After each work session, you should restart your computer to clear out anything that may have been stored in the cache memory. Make sure that your location is secure, that other family members or people coming into your home would not have access to it. Your router is incredibly important to make sure that it is safe and secure. So make sure that you change and use a complex password on your router. If you have any questions on how to do that, you can call your internet service provider and they can walk you through that process. And again, the Federal Trade Commission recommends that that password be 12 characters, upper and lowercase, and at least one symbol. Do not share your router password with others. Most routers these days can have two different networks, one that you can work on securely and another one that you can have a guest password. So make sure that, again, your router is safe. And again, if you have any questions on this, please contact IT so that we can be safe working from home as well. So every office will experience a HIPAA breach. A HIPAA breach is basically defined as somebody sees patient information that didn't have a medical reason to do so. That could be sending information to the wrong doctor's office or giving a patient another patient's paperwork or prescription. It could be that the files were scanned into the wrong patient chart. These are all common breaches that must be reported to your HIPAA compliance officer. Breaches have to be reported to the patient, and at the end of the year, they have to be reported to the Office for Civil Rights. That makes it extremely important that we report them to our HIPAA compliance officer, because otherwise they're not going to get reported to the OCR at the end of the year. And that would be a big red flag, because again, the Office for Civil Rights knows that you're going to have breaches, and if you don't have any reported, we want to know what other paperwork and other HIPAA problems that there may be in your office. So definitely report them to your HIPAA compliance officer. Now, under the HIPAA reporting rule, we have to answer 4 questions. So when you do go to your HIPAA compliance officer, make sure you know what it was that was breached, what identifiers were on it, name, date of birth, account numbers, and what treatment or payment information was also involved. Who was it made to? Did we make it to another patient? Did we send it to the wrong doctor's office? And was it actually seen or acquired? If we scanned records into the wrong patient's chart, that patient may have gone into and seen the information through the patient portal, but they may not have. The HIPAA compliance officer will determine that. And then the last question we have to know is what was taken to mitigate any harm. We fax something to the wrong doctor's office, we ask them to shred it, we get it to the correct office. Again, I get to my HIPAA compliance officer, not tomorrow or the next day, but as soon as possible to report this breach, because each state has different timelines in when we must report it to the patient as well. So again, you're not going to get into trouble for reporting it, and we have to have these because they have to be reported to the government as well. Not every release of patient information is going to be considered a breach that we have to document. In our office, we can use the incidental use or disclosure rule. And that means if a patient hears another patient's information and it was incident to a proper disclosure, then that's going to be covered under incidental disclosure. So for in the office, we do not have to fill out a lot of breach reports. An important part of that policy is a clean desk policy, and that means if you've got paper with records with patient information, keep them turned over when they're not in use. It also means that when we leave our desk, we should not be leaving patient information up on the screen. So Medicare fraud and abuse is a huge problem in our country. Every year, billions of dollars are wasted through Medicare fraud. So Medicare fraud is defined as making false statements or misrepresentations to obtain federal payments, or otherwise misusing your position as a healthcare provider to make prohibited referrals or getting remuneration for other services. Examples would be knowingly billing for services at a higher level of complexity than the service actually provided for. Medicare abuse is different from fraud in that, but the result is the same: unnecessary cost to the Medicare program. So abuse includes any practice that is not consistent with the goals of providing patients with services that are medically necessary and meet what that patient needs. Understanding that billing for services that were not actually medically necessary is a abuse of the Medicare system. And misusing codes on a claim, such as upcoding or unbundling codes, is also abuse of Medicare. There are other laws that you need to be familiar with: the False Claims Act, anti-kickback statutes, physician self-referral laws, and others under the Social Security and United States Criminal Code. If you have any questions as to what is and is not Medicare fraud or abuse, please get with your HIPAA compliance officer or office manager. It is the Office of the Inspector General, the same agency that enforces information blocking, that does Medicare fraud and abuse investigations. If you feel you need to notify the OIG, on this screen are the appropriate phone numbers. So in conclusion, healthcare is a balancing act. Matching privacy and security with what is in the best interest of the patient is often something that falls into the gray area. So always make sure that when you're applying HIPAA, that you're doing what is in the best interest of the patient. If you feel you went over the line, document it, get with your HIPAA compliance officer, get it reported so that we can, again, make sure that your practice is providing the best health care out there, and that you're also following good privacy and security practices. So this video was recorded in March of 2023, and we do know that there are proposed rules that probably will go into effect later this year. So please stay on the lookout for new and updated HIPAA information from High-Tech Associates or your other providers. And a reminder, if it's not documented, it's not done. Training is required to be documented. Sanctions can and must be applied. And whenever we terminate employees or business associates, that needs to be documented. Don't forget to document those breach reports, security incident reports, and remember, read your notice of privacy practices so that you comply with your requirements. I sincerely want to thank you for your time and attention today. I've hoped you've learned your rights as a patient, how to be safer out there in the digital cyber world and on computers. We do have a lot of forms that we've shown you and a lot more available in our HIPAA compliance kit, as well as additional trainings, further training on Medicare fraud and abuse, information blocking, telehealth, and cybersecurity. So please contact us if any questions, or go to our YouTube channel, HIPAA TV. But again, thank you for attending today. And if you have any questions, we are always there to help. Thank you.